So now we'll move on to the various types of orgasm and how to achieve the various types of orgasm. So like I said, the common one and the one that everybody knows is the orgasms are named based on the area that is stimulated to cause the orgasm. So you can have clitoral orgasms, you can have vaginal orgasms, you can have cervical orgasms, and then you can have a combination of all of these things. Some studies also say that there are anal orgasms, there are also throat orgasms, there are also nipple orgasms just by stimulating of these particular areas. Now to the almighty clitoris. And this is the deception that we have all been faced with. And a lot of people do not know the extent and nature or structure of the clitoris. And sadly, in our medical books, medical anatomy, you scan through, you go through anatomy of the female reproductive, but you never really see the structure of the clitoris as it is here. And so this is how the clitoris looks like. So if you want to stimulate the clitoris and you focus only on the glans clitoris, to the neglect of these particular areas, the vestibule, this is the vestibule, and then this is the crus clitoris. And then there is usually a small cover around here, which is the clitoral hood, which is the equivalent of the prepuce or the foreskin in males. So this is the equivalent, as you can see. And so if you want to obtain a clitoral orgasm, in fact, a lot of women achieve orgasm by self-stimulating or by masturbation than during sex. And this is also another area of concern where you have other females stimulating their fellow females, either with their hands or with their mouth, what we call cunnilingus, or with their mouths, in order for them to achieve orgasm. And our ladies are running away because they have never achieved such types of orgasms with their partners or with their male partners. And so if you are a male and you do not want to go down on your woman, or you do not want to cause extra stimulation to the clitoris of the woman, then you may be missing something very, very important. And you may be denying your partner of full pleasures of sex. I earlier on stated how you would stimulate the clitoris. You first of all start by doing a swelling and then a gentle back and forth as the person gets more stimulated, evidenced by her appearance, evidenced by the kind of sounds that she would make, evidenced by how she also touches you back. You would gradually increase it. And you would also notice that the size of the clitoris would also be increasing. As the size of the clitoris is increasing, you'll be able to locate the shaft of the clitoris in order to continue your stimulation in that particular area. And then use your other fingers to stimulate the vestibule and the crus, which you would find in the labia minora and labia majora region, or better still, the lips of the vagina. So once you do all of these things, the person can get a clitoral orgasm. Ladies and gentlemen, that is it for the clitoris. So know the clitoris and enjoy your sex with your partner. Then we have vaginal orgasm. Vaginal orgasm, as the name implies, is achieving orgasm through vaginal penetration. And I would want to state this and tell you the various parts of the vagina. So, like I said, here you have the potential space, which is the vagina. And then these rough edges are what you call the rugae of the vagina. Then there is this part. Can you see my arrow?
Yes, yes.
Very good. This part is the anterior fornix of the vagina. And over here is the posterior fornix of the vagina. This area here is called the A spot. And the name is coming from the fact that it is anterior. And then there is this area, the posterior fornix, is called the O spot, which is coming from opposite of the anterior. These areas are very, very sensitive. And this small ending that you are seeing here is the cervix. And so if you are having sex with your partner and you are able to reach this particular areas, the person is likely to get extra stimulation and reach orgasm. How can you reach these areas? Obviously, size helps, but size alone is not the exclusive determinant of reaching this particular area. If you understand the anatomy and the woman bends down and gives you a doggy, what it happens is that it opens this particular area well and gives you an easier reach to the cervix and to the fornix. And so if you are trusting, you have to trust strategically and know where you are trying to aim at. Once you are able to locate this particular area and notice that the woman is having extra feeling in that particular area, you stay there and continue. Once you stay and continue and keep doing it at a higher frequency, the woman is likely to reach an orgasm. This area, which is the opening of the cervix, is also very sensitive. And it is this particular area that sometimes when you are trusting, the woman has given you, your partner has given you doggy, you are trusting, then the lady will begin to feel a sudden pain. That is the cervix that you usually hit. And so if you hit it so much, the pleasurable feeling can turn into a painful feeling. But if you hit it rhythmically and at a frequency that the woman enjoys, the woman is likely to reach an orgasm. And this type of orgasm would be called a cervical orgasm. And notice the area of this particular thing. This is the uterus. And all the connections that it has around this particular area through the nerve connections. Once you reach a cervical orgasm, it can transmit to all other parts of the body. And that is when you would see that women are having orgasmic seizures, where all parts of their bodies are shaking. And this area is very, very powerful. So positioning is important in locating this particular area. The size of the woman is important. Fat woman is more difficult to locate this particular area if she is lying down. And so you would have to change your position. Even if it is doggy, doggy becomes more difficult because of the size of the buttocks. It becomes very difficult for the penis to reach that particular area. And so you would have to continue to change the person. You can lift the leg up into a reverse missionary position and then reach this particular area. The other part of the vagina, which